Good afternoon, teacher. I will tell you a topic, hemothorax after thoracentesis. First, I will tell you the definition. Hemothorax after thoracentesis. Thoracentesis, also known as pleural tap, is a procedure done when there's too much fluid in the pleural space. This allows a pleural fluid analysis by performed in the lab to figure out the cause of fluid accumulation around one or both of the lungs. To rule out the presence of empyema and diagnostic ultrasonographic guide, thoracentesis was performed in the left lung in the ninth and 10th intercostal space. The initial fluid that was extracted had a brown discoloration but was transurative and was thought to be associated with the patient's cardiorenal disease.
Is the space between the lung and the inside of the chest cavity. The pleural space can be filled with fluid as a result of disease processes such as congestive heart failure and/or kidney disease, infection as in pneumonia, or cancer. Thoracentesis is the drainage of the pleural fluid that's in the pleural space. My name is Dr. Khalid Saleh. I'm a staff physician at the Respiratory and Critical Care Institute at Cleveland Clinic, Abu Dhabi. Generally, the patient presents with shortness of breath and chest pain. The physician typically orders a chest X-ray. It might indicate that there's fluid in the pleural space. The procedure is very important in terms of making the diagnosis, whether the patient is having heart failure or infection or cancer, because the treatment for each one of these diseases is completely different. Also, to relieve the symptoms and hopefully treat the patient in a way that the fluid would not recur. The procedure is very simple with very rare complications. It can be done as an outpatient in the outpatient clinic or in the patient room. The patient had to be in a sitting position. The skin between the two ribs will be anesthetized, followed by 2 to 3 millimeter incision. More anesthetics will be used into the area between the two ribs down to the pleural space. A bigger needle will be then introduced into the pleural space. Catheter will be advanced, the needle will be withdrawn. Typically 1 to 1.5 liters of fluid will be drained into bottles. The patient will be asked to hold the breath as the catheter is removed from the pleural space. Patient then will have a chest X-ray to look at the results of the drainage and make sure there is no lung collapse. The procedure is considered simple and safe. Patient can go home typically in 30 minutes to 1 hour after the vital signs confirmed to be okay. On very rare occasion, the patient will have cough and discomfort that may last half an hour to 1 hour. It is essential that the patient follow up with the physician on the results of the pleural fluid to make the diagnosis.
Applications in medicine. The goal of thoracentesis is to drain the fluid and make it easier for you to breathe again. The amount of fluid drained varies depending on the reason for performing the procedure. It typically takes 10 or 15 minutes, but it can take longer if there is a lot of fluid in the pleural space.
Puncture site is chosen. The puncture is made at the point of optimal access to the fluid. This is the fluid accumulation in the pleural space. The puncture site is disinfected. Local anesthesia is injected in all the tissue from the skin to the pleural space. A small incision is made in the skin with a scalpel blade. A pigtail catheter is inserted into the pleural space. The introducer is retrieved and a three-way tap and tap bag are attached. Flow is checked by aspirating with a syringe. The puncture wound and catheter are bandaged.
Pros and cons. Pros. Abnormal results on a pleural biopsy can indicate certain causes for the effusion, including the presence of cancer cells such as lung cancer, mesothelioma, which is an vector-related cancer of the tissues that cover the lungs, collagen vascular disease, viral or fungal diseases, and parasitic disease. Cons. The risks of this procedure may include aiding the space between the lung covering pleural space that causes the lung to collapse, pneumothorax, bleeding, infection, liver or spleen injury.
A collection of fluid in the pleural cavity, and this is a cavity between the lung and the chest wall. This can be either exudative, meaning there's a high protein count of above 3 grams per litre of protein, or transudative, meaning there's a relatively lower protein count of less than 3 grams per litre. Whether it's exudative or transudative helps you to determine what the cause of the pleural effusion is. Exudative causes are caused by inflammation, and the inflammation results in protein leaking out of the tissues into the pleural space. Ex meaning moving out of. Think of the causes of inflammation when you want to think of the causes of exudative pleural effusions. And this is things like lung cancer, pneumonia or lung infections, rheumatoid arthritis, and tuberculosis.
When you inhale, the lungs transfer oxygen from the air to your blood. They also take carbon dioxide from your blood and get rid of it when you exhale. Lung cancer is a disease caused by the unchecked growth and spread of some cells from the lungs. Non-small cell lung cancer is one of 2 major types of lung cancer. The other one is a small cell lung cancer. Tests for detecting possible lung cancer include both non-invasive tests and invasive tests. Non-invasive tests include chest X-rays and CT and PET scans. Invasive tests include bronchoscopy, endobronchial ultrasound, thoracentesis, biomarker testing, and biopsies such as fine needle aspiration or FNA, core needle biopsy, and surgical lung biopsy. Your doctor can remove a small sample of your lung tissue where cancer is suspected. This is known as a lung biopsy. To check for cancer, a pathologist studies this biopsy sample under a microscope. If there is cancer, tiny amounts of the sample are tested further for specific features that will identify the exact type of cancer present.
Issue applied in Ecuador. The biggest problem in Ecuador is that when performing thoracentesis, the necessary measures are not always taken to perform this procedure, and the patient may suffer a more serious secondary problem.
Thoracentesis is performed to assist in the diagnosis and therapeutic management of patients with pleural effusions. After anesthetizing the skin in the typical wheel fashion, anesthetize the deep tissue. Insert the needle above the rib to minimize manipulation or laceration of the vascular bundle located beneath the rib. As the needle advances, identify the pleural space by the presence of pleural fluid aspirate in the syringe. Placing a sterile gloved finger on the needle at the point where it exits the skin approximates the length of the insertion for the thoracentesis needle or catheter. During needle insertion, the open stopcock valve allows aspiration of pleural fluid while minimizing the introduction of atmospheric air. The pleural fluid is used for laboratory testing to help delineate a differential diagnosis.
For the conclusion. Thoracentesis is very useful today because it allows the fluid that is preventing breathing in the lungs to be removed. This procedure can also biopsy lung tissue to be examined if there is any anomaly that can lead to more serious disease. Hemothorax after thoracentesis have been reported correlations between increased tortuosity of intercostal arteries and decreased safe space for thoracentesis, particularly in older patients. Thank you.